this video, we're going to discuss about insurance related terms, starting with Department of Health and Human Services, also known as DHHS. Now, this Department of Health and Human Services is something similar to our Ministry of Health and Family Welfare. It is the federal agency that administers healthcare programs to protect the health of all Americans and provide essential human services. Now the next one is CMS, Centers for Medicare and Medicaid Services. It is the federal agency that runs the Medicare, Medicaid, Children's Health Insurance Program, and the federally facilitated marketplace. Now, a marketplace is a website run by the government where people can shop for health insurance programs. Medicare, Medicaid, and Children's Health Insurance Programs are federally funded insurance programs. That means government insurance. Now, CMS is the regulatory body for healthcare in US. Now the next one is AMA, American Medical Association. Now this is something similar to IMA, Indian Medical Association. The AMA is the largest organization of physicians in the US dedicated to improve the quality of healthcare administered by providers across the country. The current procedural terminology CPT code set is maintained and revised by AMA in accordance with federal guidelines. So the AMA collaborates with federal agency like CMS when making changes to the CPT code set. The next one is Healthcare Financing Administration, also known as HCFA, the branch of Department of Health and Human Services that operates the Medicare program. Now the next one is Social Security Administration, SSA, the branch of Department of Health and Human Services that operates the various programs funded under the Social Security Act. It also determines when an individual becomes eligible for Medicare benefits. As you can see from the figure, the Department of Health and Human Services is divided into different branches: CMS, HCFA, and SSA. Now, HCFA takes care of the Medicare program and SSA takes care of Medicaid program. Now the next one is Clinical Laboratory Improvement Amendments, also known as CLIA. It is used to regulate and to establish quality standards for laboratory testing performed on specimens from humans such as blood, body fluids, and tissues. It requires all clinical laboratories to be certified by Centers for Medicare and Medicaid Services, CMS, before they can accept samples for testing. So all the diagnostic laboratories in US must be certified by CMS before they can accept samples for testing. Even in India, if you want to start a diagnostic laboratory, you need to get permission from the concerned authorities. Now the next one is National Drug Code, NDC. The NDC or National Drug Code is a unique 10-digit 3-segment number. It is a universal product identifier for human drugs in the United States. This code is present on all non-prescription OTC, which means over-the-counter medication, and prescription medication packages. As you can see from the figure, the first 4 digits indicate the labeler code, the next 4 digits indicate the product code, and the last 2 digits indicate the package code. Now the next one is COBRA, which is Consolidated Omnibus Budget Reconciliation Act. It is a federal law that may allow an individual to temporarily keep his or her health coverage even after the employment ends, or when the individual loses coverage as a dependent of the covered employee or any other qualifying event. Now, as we discussed earlier, an employee is covered under the group insurance provided by the employer till the time he is working there. Once the employment ends, the group insurance coverage will terminate. Now, the person will not have health insurance till he joins a new company. It is considered very risky not to have health insurance in US because the healthcare is very costly. So the employee can opt for COBRA coverage, which lets the employee keep insurance coverage even after the employment ends. But the employee has to pay the premium along with a small administrative fee. Once the employee becomes effective under the new employer insurance, the COBRA coverage will terminate. Now the next one is third-party administrator, also known as TPA. It is an organization that processes insurance claims and or does the pricing of claims based on the knowledge of coverage and exclusions on behalf of a separate insurance company. It is also a term used to define organizations within the health insurance industry which administer other services such as underwriting and customer service. Now, in the US healthcare system, there are few small insurance companies which take the help of big established insurance companies in determining the policy guidelines under which a person should be issued a policy, how much should be the premium and what should be the benefit level, etc. Now, this process is also known as underwriting. And since the big insurance companies have the necessary infrastructure, they process the claims on behalf of the small insurance companies, and the small insurance companies sends out checks to the providers. Now, the next one is downcoding. When the insurance company reduces the code and corresponding dollar amount of a claim when there is no documentation to support the level of service submitted by the provider. Now, say for suppose the provider bills a high-level CPT code to the insurance company without supporting documentation like medical records. And if the insurance feels that the service provided to the patient does not require a high-level CPT code. Now, as we have already discussed, when we say a high-level CPT, it indicates more time spent with the patient. Then the insurance company will reduce the level of CPT while paying the provider. The next one is bundled service. When a payer refuses to pay for two separate services a provider has billed, instead it groups or bundles the two charges and pays for only one service. Now, in case of a surgery, if the surgeon bills for incision, which means cutting the skin, and again for putting stitches on that incision, then the insurance company will bundle both the codes and they will not be paid separately. Now the next one is not elsewhere classifiable, NEC, a term used to describe a procedure or service that cannot be described within the available code set. Now, say for suppose a patient walks into the doctor's office with a complaint of headache. The standard diagnosis code used for headache is R51. Now, if the patient says he has headache on the right side of his head or left side of his head, then there will not be any specific CPT diagnosis code to indicate that. Now, the next one is coordination of benefits. A system used in group healthcare plans to eliminate duplication of benefits when the patient is covered under more than one group plan. Benefits under the two plans usually are limited to no more than 100% of the claim. Now, when a child has insurance coverage through his father's group insurance as well as his mother's group insurance, then the insurance company should be updated by the guarantor of the child as to who should pay as the primary and who should pay as the secondary. If both insurances pay as primary, then it will not be acceptable as the benefit payments from the primary and secondary insurance should not exceed 100% of the claim payment. Now the next one is birthday rule. One method used by health insurance companies to determine which parent's health insurance coverage will be primary for a dependent child when both parents have separate coverage. Typically, the health insurance plan of the parent whose birthday falls earliest in the year will be considered the primary. If the father's birthday comes first in the year, then his policy will be the child's primary coverage, and if the mother's birthday comes first in that year, then her policy will be the child's primary policy. Now the next one is rider. Coverage options that enables to expand his or her basic insurance plan for additional premium. A common example is a maternity rider. Now let us assume that a female has a basic insurance plan. When she gets married and becomes pregnant, her basic policy will not provide maternity benefits, in which case she can opt for a rider which will provide maternity benefits during her pregnancy. Now the next one is global period. It is a time frame after the surgery during which all follow-up services are covered under the payment for the major procedure or surgery. Now, depending upon what type of surgery is performed, there may be a follow-up period during which follow-up care is included in the payment for the major procedure and not separately payable. That care is considered bundled into the global surgery fee. Now let us assume an orthopedic surgeon performed a leg surgery. Usually the global period for a leg surgery is 10 days. Now if the patient is coming back on the 7th day to get the stitches removed, then the doctor cannot bill this service to the insurance company as it falls within the global period time frame of 10 days. This follow-up visit payment is considered to be included in the leg surgery fee. Now the next one is retraction or reversal. It is a scenario in which the insurance company has made an excess payment to the provider in error and is requesting for a refund. The insurance company The next one is offset. It is a scenario in which the insurance company has made an excess payment and a refund has not been made by the provider within the stipulated time. The insurance company then reduces or retracts the that excess amount from future claims of the particular provider. Now, the insurance company is going to send 3 letters to the provider requesting for the refund. And if the provider does not respond to those requests, then the insurance company is going to adjust that amount towards the payment for another patient's claim. Now the next one is refund. This is the process by which an excess payment received from the patient is returned back to the patient by the provider. Like we discussed earlier, if the copay is collected incorrectly, the doctor has to refund that extra money collected from the patient. Now the next one is aging, a formal medical billing term that refers to insurance claims that haven't been paid or balances owed by patients overdue by more than 30 days. Aging claims must be followed up in a timely manner by the AR department. Now the last one is collection agency. It is an agency hired by the client for recovery of payments from the patients towards long outstanding balances. Thank you.